Hey guys, it's Dr. Emer, and we're late night in West Hollywood, and we are doing one of my favorite treatments. You guys know, female facial sculpting. Now, it's always great to have a beautiful canvas to work on, and we're going to use fillers today, not to plump or fill lines. We're just going to use it to sculpt. I have a young woman here who's going to be a very famous nurse injector in the future, so she's actually learning as we do this treatment. And if you take a look, she's super proportioned, very beautiful. And all we want to do is make her face pop. And to do that, we're going to focus on some of the areas where people start to notice some signs of aging, but also lose that chisel. The lateral cheek, temple border, some people call this the OG curve. Enhancing that area gives more beauty, makes the eyes lifted. We're going to define the jawline because that's the in thing right now, to be really sculpted, to have that 90-degree. And proportionally, she has a beautiful straight nose and beautiful lips. We want to keep the chin elevated and forward. It makes the neck look much tighter and more slender. So we're going to start up in the temple. And I love doing this treatment, you guys. A couple reasons why. First off, it lifts the brow, which is beautiful in women, especially in the lateral part of the brow. My girls love to have a little tail lift. And also, it blends the cheek, especially if you're going to kind of enhance the cheek area. You don't want to overdo the cheek and not have volume above, and that's what the OG curve is called. So we're gonna walk around, and I'm gonna do the opposite side, the same thing, this hollowed area right here, and it actually looks really good because we've done a little bit of filler there before. So we're just doing an enhancement, and I always tell people, it sounds so weird. You hear this cracking, you hear sometimes bubbling, but it's a very safe area. I have my finger over the main blood vessel of the area to protect her from any issues. And we're going right on the bone, a very safe area. Does that hurt a lot or no?
No, not at all.
Does it like sound weird?
This one crackled a little bit, not this one, but
So
it's just
crack.
for like half a second.
Cool. And that already, you guys can see, it just gave a nice little boost to the brow. We call it a brow boost. So now what I want to do is just enhance her cheekbones. Now in some people, we want to go a little more horizontal, and some people we want to go a little more angled. She has a very straight nose, nice brows. We want to go a little more angled on her. This will give her some beautiful improvement when she puts makeup on. It's perfect for shadowing and highlight. So I'm actually going to put my hand right at the border of the zygoma where I want to get lift. I'm going to go nice and slow right on the bone. And I'm going to use Juvederm Voluma because this is going to allow me to get a nice lift and really enhance everything. And so look at that. Right away, she's already a little sculpted. Now I'm going to take a little bit laterally and go a little further back. And everyone always asks me, how much filler do you need to get enhancement? And I always tell people, half a syringe aside, a little bit of an improvement. Full syringe is going to give you some contour. Anything more than that is going to give you a lot more lift, a lot more shape, especially at a young age. If you're a lot older, you may need more filler or you may need to do things to lift, like threads. So we're going to go back a little bit more and define her a little bit further back because we're also going to do her jawline. And the reason when this gets lifted, okay, you're going to want to enhance the jawbone as well to balance it all out. So we're going to go all the way into the apple of the cheek. Get that perfect chiseling.
Do you do fat transfer to the face?
Yeah, all the time. We love doing fat grafting. Now, in some people, fat grafting is useful because it's volumizing. And someone like her, fat grafting would not be the choice. We want to chisel and define, and it's much more elegant to use fillers.
Now, do you prime your needle before you aspirate?
Of course. I don't aspirate that often. I've been doing this for many years. It's not a requirement. But you can if you want to. I always prime. And again, there's no real reason. But now look at that chiseling. Again, that high angle, that high arch.
Now, how long does this last?
So Voluma can last up to 2 years, but we have a very thin, athletic woman. And typically, thin, athletic women, the filler lasts 6 months we're gonna want to touch up.
Now, earlier you mentioned threads. What do you mean by that? Can you explain it? What
Well,
are threads?
You guys remember, we're doing fillers right now for enhancement, okay? But it doesn't always lift. And if you're starting to sag, which she's not, if you are, we want to tighten that skin, we want to lift it. So either you can go surgical, like doing a facelift early on, or we can do things like threads that are little sutures that go inside and pull everything up. We can do something called Morpheus treatment, which is needles that tightens the skin. Thermogenal therapy, which are energy-based devices, and ultrasound. There's a lot of options.
Now you're placing her cheek filler laterally.
Yeah, we're working lateral to build here. Just small aliquots on the bone. I want to give her nice definition and contouring.
Now, for those that just tuned in, what are you using on the jawline?
Well, we're on the cheek first, and we're using Voluma by Juvederm because this is going to last a good amount of time. And it's going to have a soft lift, okay? I don't want her to look too hard because she already has a really structured face. I want her to look elegant, but shaped.
Will asks, is that Pega the superstar?
That's Pega the Beauty. Future nurse extraordinaire. Okay? So I'll show you guys in a second. I'm just holding a little pressure. Going slow, injecting slow, and holding pressure is what's been shown to decrease the rate of bruising the most.
Now, can this be dissolved?
Of course, we can totally dissolve Voluma or any hyaluronic acid fillers. Oh, they're so good. Can't make her any more beautiful, at least I thought. So, Pega's been going through finals, so she wanted to give herself a little treat. So she's getting emerized today. Okay.
Now, here's a long question. Juvederm Julie said, it's not good to prime because if you aspirate and you were to aspirate blood, it takes longer to prime a needle versus non-prime
Great.
needle.
Thank you. That's wonderful. Now, we're going to balance this higher cheek. You hold here, right there. No, let him do it. Now we're going to bring the chin a little bit. I'm probably going to do just a teeny bit in two different locations. I want to keep her chin a little more pointy and straight. I don't want to make it too wide or round because her face is very defined. So I'm going to work on projection and not going too laterally. We're using Juvederm Velour.
Now, will you use
this
sculpture here, though?
product. You could, but this is not going to sculpt her. Sculpture would build long term. The reason I love this product for her is it's extremely soft and it will last a year or two. Velour is basically a mixture of Voluma and Volbella, so it has the ability to lift, but it's also nice and soft. Okay?
Katrina says, you're amazing. When can she come in and see you for the holidays?
Come in, girl, anytime. I would love to treat you. Now, one of the things, you look at that, that is just perfect. You can see how tight the jaw looks. Now, the one thing I want to do to balance everything is do what's called improvement in the lower cutaneous lip. And this is that chin crease area that loses a little bit of volume and also makes the lip kind of turn. So we're going to soften that area as well because it will balance what we just did with the chin. You can see this little triangle right here that sometimes has a little hollowing. I want to keep her super defined, model look.
One more time for those that tuned in. What are you using on the jawline?
This is Velour. Okay. Now what I'm going to do.
Patricia said hi from Split Rock Aesthetics.
Who? Hey guys. So now I'm going to do just a pop of tightness along her jawline. So we're going to go right at the border of the jaw. And I'm going to do just a softer filler, okay? Because I don't want to make her too wide and big. Perfect.
I have a lip question. Do you lip flip with neurotoxin?
I do, but I often don't find that it's that successful. So most of the time, we're doing fillers or threads.
Now for a double chin, what would you say it's the best procedure based on your opinion?
Double
To
chin
get rid
lipo.
of double chin.
The best thing is lipo. Okay, now the last part is going to be the under eye.
Hello from Anchorage Dermatology and Cosmetics.
Hey guys, what's going on? I want you guys to tag me and say, hey guys, the next time you do a video or post. So we're gonna do a little to her under eye, and I'm using Volbella because it's softer and it's gonna blend really well. You know, when you have more of an olive or darker tone, you sometimes have darker eyes. My best friend's Indian. Hi, Shredda. She watches all my videos. She's in Chicago, great dermatologist. And she has dark circles. They're more prominent when you're darker skin type. And so the treatment is to do a little filler, peels, lasers. So we're gonna do a little of Volbella here, and I'm using a cannula because I wanna limit bruising and swelling. And it makes it easy for me to go all the way up into the trough, right here, look, right all the way up there without her even feeling anything, okay? Perfect.
You done?
That's it right there.
Can't wait for you to come to New York.
Oh, we'll be there soon.
Wait, you're coming to New York when? Tell, please.
We'll be there the 9th to the 13th of January. You should book soon because I think we're already booked. But we'll make time.
Any plans to guest spot in Florida?
Very soon. Stay tuned. We need another pokey. Oh, I got it. There we go. All right, so now we're gonna go all the way up a little bit into the trough right there.
In New York in January 9th.
New York, 9th to 13th.
And where are you located right now? For those that
We are in Los Angeles, California.
La La Land.
La La Land, West Hollywood, Beverly Hills. Okay, we're just softening. We don't want her to look tired from all her studies. All right, perfect. So I think that is a subtle beauty approach. And we can just clean her off and we'll show her real quick. Obviously, post-injection, people get more swollen. But let's show, do you want to do an Emer reveal or should we?
We should do the Emer reveal
first.
first.
Do an Emer reveal. So Emer reveal is, let's give her the, wait no, wait 1 sec, give her the phone, let her look on the phone.
Okay, ready?
Okay, take the phone, take a look. Now that's Raul.
Oh, do I have to
Hold on, that's Raul. Let's flip it. Okay, now take a look.
I love it.
So what do you think? How do you look at your face? Describe what you're seeing. What do you see?
I see that my eyes are a little bit more full. My temples gave my eyebrows kind of a lift, and my chin. I love the chin. Love it.
And the other thing I want to say is look at the neck and the jaw. Turn your head. Look at the chin. It comes out. It balances the nose, lip, chin proportion. And then look at the 90-degree angle of the jawline.
Love it.
And the pop of the cheek.
The chin.
And it all blends. Remember, the cheek to temple is called the OG curve. That is a sign of beauty. Oh my God, my hair from the surgery today. Is this, you want to keep this volumized and lifted because it makes people look younger and feel better. And when that area is lifted, you look less tired. Okay, right now I need a little bit. You guys see right here? But take a look at her compared to me. Perfect. Okay, so let's go back. Now we'll do the regular reveal. Let's give you that. Perfect. And now take a look at the mirror because it looks different on the phone.
Oh, I love this.
Great. So now it's all defined. And the other thing too, you guys, remember chins don't always have to be wide. Here we brought it out forward because that balances. Otherwise, you're going to look too masculine. You have features, you know, that are more quote masculine, but by defining them, we make you look more elegant and more feminine, and that's how we do it. Now she looks like a supermodel. That's the key, right?
I love
so
my cheeks.
you've been
Emerized.
Exactly.
Before you
That's
leave,
our new thing, guys. What?
where in New York? Where will you be?
So we're at Dr. Velasquez's office in Midtown. Email us, appointments at jasonemermd.com, or go to jasonemermd.com. We will be there doing fillers. We're going to be doing liposuction procedures. We do skin tightening and lasers. A lot of my acne scar patients see me. And I have patients that I've been seeing for 13 years because I did my residency in New York, everybody. So stay tuned to come to New York with us and be memorized. Bye.